Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin. Actually, this is our new podcast called the New Dentist Coach Show. So look, today's episode is actually part of a series that we just created called Careers in Dentistry. Careers in Dentistry. And today we're doing part 2 of this specific career in dentistry is called How to Become an Endodontist. And today we're joined with Dr. Cheryl Crawford, who's a board certified endodontist. And for those of you that don't know what an endodontist is, you're about to find out. All right. So Dr. Crawford, welcome. Thanks for joining us today, man.
Thank you for allowing me to be here.
So go ahead and kind of introduce yourself. Tell us a little bit more about yourself.
Again, my name's Dr. Cheryl Crawford. I'm a practicing endodontist in Orlando, Florida. I own 3 practices or 3 locations. One is in Orlando, as I just mentioned. The other one is in Winter Haven. And the last one is in the city called Lakeland. And as you know, an endodontist endodontics is a subspecialty within dentistry. So we treat the maladies and we treat symptoms of tooth infection primarily by removing the pulp or the actual nerve and then filling the tooth, allowing a patient to have the tooth restored and to keep it for form and function.
Gotcha. So tell us a little bit about your actual training. Of course, you know, as an endodontist, you're also a dentist. You know, you were a dentist first, but tell us how long it took you to become board certified and that training that goes through that process.
Right. So what happens is that after dental school, 4 years of dental school, I ended up being accepted at Bronx Lebanon Hospital, which is in New York, and I did a 1-year GPR, or general practice residency, where you actually will have the skills that you learned in dental school. For example, I attended Temple University School of Dentistry in Philadelphia. So those skills that I learned within those 4 years were then sharpened and honed, and I actually was able to even learn more dental subspecialties and skills in the GPR. After that 1 year of the residency at the hospital, I then went ahead and was accepted as a candidate for an endodontic program, which was out at Case Western Reserve University, which is in Cleveland. So I did 2 years of specialization training there, and I left Cleveland and moved back to Florida. And I've been in Florida for the last 13 years.
Gotcha. So as a board certified endodontist, is there any additional training that's required or preparation? Can you tell us a little bit about that?
Well, what happens is that once you finish your program, and my program is a 2-year master's program, so I have received not just a certificate of training, but also I wrote a thesis. So I defended that thesis, and as a result, I was able to receive not just a certificate of completion of the program, but also I received a specialty degree, or master's, I should say. So excuse me, I escaped my mind for a second. But what happens is that after that, then you're able to sit for your boards, where you have to present a certain amount of cases that you have actually treated patients for in your subspecialty. Then you also would have to you're required to verbally be tested by board certified endodontist. And then you have a written portion of the examination to become board certified as well. So, and there's a difference between being board certified and board eligible. So,
Gotcha.
All of which are both very good. So,
is that board certification, is it required in the U.S.? Is it a process that it's just 1 day, 2 days? What's the process like?
Well, the process is lengthy, and it can take months or even years to actually accomplish. So presently, right now, there's only about 23% of all endodontists are board certified. So it's definitely that added feather in your cap as far as your recognition in your subspecialty and in the profession itself. But what happens is that it is very, very important because it does make the distinction that the specialty is or has a legitimacy amongst your peers as well as other facets of dentistry or of medicine, I should say as well.
Gotcha, gotcha. So share with us what your typical day is like as an endodontist, especially as an owner endodontist with your 3 practices. What's your typical day like?
Typical day is for me is I will wake up somewhere right around about 5 a.m., 5:15. I will, I'm a father of 4. I'll prepare my children for school. We get ready by having, a morning powwow, having prayer and breakfast, and then I'm out the house to see my first patient by 7 a.m. First patient typically is going to be someone that has already been pre-diagnosed or that I've already seen for a consultation. In an average day, I may see or perform maybe 10 to 15 procedures, sometimes even more, depending upon the emergency patients that may be seen on top of the regular scheduled patients. In the morning, typically, I will have a morning huddle with my chief operating officer as well as my managing officer, or excuse me, and that managing or MO managing officer, she's the more direct operations chief for the offices. Now, the COO is synonymous with also my CFO, so he pretty much will control the day-to-day operations also from more of a comprehensive view. And I will continue to see patients and make certain executive decisions from the chair. I will also answer and entertain, questions from referring doctors. I will talk to pharmacists. I will talk to just about almost anyone with regards to patient care, patient treatment, and the, again, day-to-day operations of all 3 practices.
Nice, nice. Sounds like a busy day.
Very
During your
busy.
day, tell us about the different types of procedures that you perform as an endodontist.
Well, typically, endodontist, we have to be not only part clinician, but also part, investigator. We have to be able to discern whether or not, a patient is going to be, helped or assisted by the treatment of root canal therapy. So, we have to kind of figure out exactly if the patient that's coming to us is it truly indeed in need of our services. So typically we will start off with a regular consultation following the rendering of a chief complaint from a patient, whether or not they're in pain or they've had discomfort or swelling, so forth and so on. After we've determined that the patient is truly indeed in need of our services, we will then go ahead and schedule them for treatment, for definitive treatment, or we will go ahead and provide treatment that day. Typically, the procedures about 80% of the time that I perform are going to be a non-surgical root canal therapy, where after anesthetizing the area, we will remove any type of decay. We will make an access opening or a small hole through the top of the tooth, where we will then go ahead and extract the nerve or the pulp tissue. We will clean, shape, sterilize the inside of the tooth, thus helping the body to heal and alleviating any type of symptomology. We'll then place a temporary filling, and then that's the end of that particular non-surgical procedure. Probably the other 20% are going to range, or procedures are going to range from surgeries as well as other adjunct procedures, maybe an incision and drainage, also the reduction of occlusion, things of that nature.
Gotcha, gotcha. So you mentioned that you start your days pretty early. What are your typical work hours then? If you're starting around 7 with your first patient, and do you work in the evenings or even weekends?
Right. Well, when we first started our practice group, we were working on Saturdays and we were working late hours all the way up until about 9 p.m. However, as the notoriety of our practices have gained, traction in the local dental communities, we've been able to kind of scale back and also to tailor our operating hours. So myself, I tend to work from 7 to 3. I have other associates in the other locations that will start their business day seeing patients anywhere between 8 to 9 and going all the way to 4 or 5 p.m.
Gotcha. Okay. A lot of training, a lot of working hours, a lot of hard work. What's the typical salary, especially for an owner endodontist? What's the typical range or average for owner endodontist?
Right. Well, for an endodontist, typically the general rule of thumb is that for every day that an endodontist may work, the average income is between $100,000 to $150,000. So if you work, say for instance, 4 days a week, and you're at that upper range of 150,000 off of a 4-day work week, you'll probably earn about $600,000 a year. Now, granted, that's it varies because of the fact of how you're paid, the percentage that you receive on each patient or each procedure that you may perform, as well as the particular demographic area that you're in. As far as being a business owner, that's slightly different. Of course, you are providing a place for employment for other doctors. So those doctors are paid to scale. Typically, they may be paid at 30, 40, or 50% or slightly more for the procedures that they perform. And then, of course, the residual or what's remaining typically is reinvested into the practices, and then the owner will take either an allocation or a dividend, either monthly, quarterly, or at the end of the year. And that's actual income that goes to the actual owner of the practice.
Right. Okay. So you have a average salary, and then your owner, you have some other monies that sounds like it goes back into the practice, but also a percentage may go towards the owner as well. Okay. Gotcha. So knowing this and knowing what you know now, after practicing several years, almost 20 years now, knowing what you know now, what would you do differently?
Oh, probably differently, just to spend more time with my family. I would probably own less offices, or I would have probably had a number two, someone who's going to be maybe in ownership with me. Only simply because, as the old adage goes, no one's going to treat your baby or treat your business as well as you do. So although you may have associates, they may not always be correctly or similarly aligned with you as far as, like, or the way that you have a certain treatment protocol set up. So if I were to do it differently, I would definitely say either A, own less practices, or either B, had a partner from day one to open the offices with and to kind of shoulder the burden and responsibility of ownership.
Right. Okay. That sounds good. What advice? And that leads us to this question about advice. What advice do you have for those pre-dental students or current dental students that are aspiring to become endodontists, or future, just for advice for those that are within the health professions, but more specifically for endodontists?
I'm sorry, I couldn't hear that question.
I said, what advice do you have? What advice do you have for those aspiring dental students or dentists that are contemplating or thinking about the specialty of endodontist? Dentics, I'm
Okay,
sorry.
as far as dental school students or residents or of AEGD or GPR who's interested in specializing, I would say to find a great mentor, to think about the aspect, the good, the bad, the ugly, the pros and cons of specializing, and knowing that this is definitely a subspecialty of endodontics, being something that's going to be very specific. You will basically be doing almost the same thing all day, every day, with the simple fact of knowing that each and every tooth is totally different. In doing this since 2003, I've never seen one tooth exactly like the previous or another tooth. So it does have its advantages and its rewards to specialize, because of course you're very good at a small scope and you know quite a bit about one specific area. So it's great, and very, very rewarding to be an endodontist or a specialist.
That's great. That's great. So last four questions. Last four questions. We ask everyone these questions on the show. Last four questions. So, what is your favorite day of the week?
My favorite day of the week, believe it or not, is Monday.
Monday. Oh my goodness. Some people are hitting their heads upside the head on Monday. Why Monday?
Monday is my favorite day because it brings all the actual the capabilities. It opens up everything new for that upcoming week. Everyone loves to say, Friday is their favorite day. However, as the old adage goes, find something that you love to do and you'll never work another day in your life. And that's exactly it. I love endodontics. I love the fact of working hand in hand with a patient who is either A, in pain, or B, needs some type of prosthetic or some type of operative procedure to brighten their smile.
Yeah.
And it helps them with their self-esteem as well as their overall health. So with me coming to work on Monday, I look at all the possibilities that week can hold. And with that being said, I look at the emergencies. I look at everything, and it's just a blessing to be able to help people from an endodontic standpoint.
That's right. That's right. Favorite food. What's your favorite food?
My favorite food, actually being from the South, my favorite food is going to be anything Southern. So whether or not it's collard greens to, oh my goodness, red velvet cake, anything Southern, that's going to be my favorite food. I know that's a cuisine, but I just can't narrow it down. But anything Southern, I love it.
Gotcha. Gotcha. Third question. What's your favorite procedure or task in the office as far as what you do as an endodontist?
Well, my favorite task as an endodontist, I already know that I love doing root canals, but also at the same time, because I have aligned myself with such a great staff, I love to learn, and I learn through delegating. So I will allow for my staff to, after our morning huddles, I will love to delegate certain tasks and then look forward to seeing how those tasks are actually completed. It talks a lot or teaches a lot as to the type of individuals that you've hired, as well as the type of individuals that you have around you. And you also learn from that as a leader about the individuals who are following you or working directly underneath you.
Right, right. Last question for you today, Doc, is what is your favorite action or activity outside of work?
Oh, favorite activity, more than likely is going to be spending time with my family and anything, traveling or going to the beach, just being in their midst, because I know that my children who are young, they're only going to be young for a certain period of time, and then
That's right.
that's it. So that's time that I don't have to get back, and I'd have to say that's going to be my favorite activity outside the office.
I agree, man. Family time is so important, especially when you're a father. It's very, very key. So, Dr. Crawford, thanks so much for your time today. We appreciate you. How can we get in contact with you? How can people get in contact with you if they want to talk to you more about this specialty or about ownership and practice? What's the best way to get in contact with you?
Well, you can always email me, and it's fairly simple. It's extract1@gmail. And that email is going to be, and I'll spell it out, extractone@gmail.com. All spelled out, no hyphens, nothing capped. Just simply extract1@gmail.com.
Gotcha. And what's your website to your practice in Orlando?
Oh, the website is going to be trinityendogroup.com.
TrinityEndo.com.
STRINITY endogroup.com.
TrinityEndogroup.com. And we'll put that down here at the bottom so people can get in contact with you. Any other projects you want to tell us about that you're working on? I know you're a big time entrepreneur and might be starting some new projects. Anything you want to share with us before we close?
Sure, absolutely. Thanks so much for giving me the opportunity to do so. What happens is that I was actually able to become the second generation of entrepreneurs to follow in my father's footsteps in helping to develop and to relaunch a skin emollient, which is actually a barrier cream that protects your skin from acids, from anything that's caustic, or any other type of pathogens, say for instance, viruses, bacteria, or funguses. And what this is it's actually a skin emollient or a lotion that lasts for 4 hours, and it's called Skin Armor. And you apply it simply as lotion or cream, and it will protect you for up to 4 hours. And again, you'll never know it's there. It's breathable, and it does protect you from becoming inoculated by bacteria or from any other type of pathogens. And quite simply, say for instance, in this day and age, there's a lot of people who don't like to have personal contact, shaking hands, or what other type of or any other type of salutations or gestures. It's okay to shake people's hand, or a person's hand, I should say, excuse me, if you wear Skin Armor, because whatever bacteria is on their hands stays with them, and vice versa. Whatever's on your hands stays with you, and it lessens the actual ability of you becoming sick or inoculated with whatever is on that other person's hand. So again, it's a liquid, a lotion, it's a barrier, and one of the first of its kind. It's green. It's a green formula, and it's selling very well. And we look forward for it to continue to gain traction in the open market. So thank you for allowing me to talk about it.
No, well, thank you. I got mine in the mail not too long ago, so I'm going to try it out, man. It's the Skin Armor.
Yes, sir. Thank you.
As a courtesy to you. So thank you for sending it to me. I appreciate it. Hey, guys, that's our time. This is Dr. Darwin, the new dentist coach, with today's episode with Dr. Cheryl Crawford. Careers in Dentistry, Endodontics, one of the leading endodontics in the country here. Thanks so much, Dr. Crawford. And hey, if you guys have questions, or if you have a career within dentistry that you want us to explore, send me an email. Send me an email at newdentistcoach@gmail.com. newdentistcoach@gmail.com. Hey, again, Dr. Crawford, thank you so much. We'll be talking to you soon. Thank you.
Thank you.